So the Patients Association, what I want to do is just set the context a little of what it is. And I was just talking to a colleague a moment ago. It is 50 years old. That surprised me, and I didn't know how many of you knew that's been around. We are increasingly asked as an organisation to participate, involve and attend sessions such as this, rich sessions such as this, which is great. So just a little about what is the Patients Association. Well, very proud, it's an independent charity. So I think the question about funding we heard a minute ago, you can imagine what it's like for something like the Patients Association. There's a few bullet points, I'm not going to read them all. The third one, very important, which was why I wanted to give my time. And I looked at not its mission statement, but I looked at what it does before I decided to give up a certain amount of my time to work with them. And they campaign on patients and carers issues raised on their national helpline. So they don't go out asking for comments, which you might do when you get participants on the study. They rely on people, we rely on people ringing in. And one of the reasons that it is effective is because it's deciding, rather than just being a complaints repository, it's turning the comments, the stories, the narratives from patients and trying to make a difference politically and in practice. And one of the reasons is to work directly with local trusts, with providers of healthcare, sharing the stories from the patients themselves. And more recently, as you can imagine, particularly in the last year, in 2013, with the plethora of formal reports that have come out, we want to try and affect change politically. And I'm quite sure, I was talking to someone just a minute ago, I'm sure we're used sometimes as the icing on the cake, politically, whether it's at Whitehall or whatever, but we take any opportunity we can to influence the patient's experience at a political level. So, what about, and I just want to add on to that, the other thing I've noticed in the last 8 months is how often the Patients Association is asked to be partners in research bids, in research submissions. And if I can influence them at all, and there's about 8 or 9 of us as board members, my role is to say, yes, why don't, look at the bid, look at the topic, and say yes, but not just as a passive partner. We ought to be there, actually helping to mould and design everything in the research study, including our comments on the methodology. So what sort of things have the Patients Association been working on to date? Well, first of all, our premise is that it works best if you get in at a local level. So our colleagues who work for the association, both paid and non-paid, certainly are dispersed at local level across the country. We've suddenly, in the last 2 years, found a good increase in our request to work with healthcare providers to help find solutions to some of the issues that come up through the patient stories. And I'll go through some of those. Building relationships with NH trusts and healthcare providers. We believe it's much better to get alongside healthcare professions who are delivering the care rather than standing outside telling them what they should be doing or what they're not doing, because that causes a great deal of defensiveness. Much better to get alongside them. Oh, I should have said also, by the way, I am a nurse as well, so I have that added ownership, I suppose. We've been developing a range of tools and methods to work with healthcare providers on a wide range of topics, but the most important one probably is learning from complaints. They're a rich source of what hasn't worked, so how can we make things better? Now this is a list of various projects. I'm not going to go through them all. It shows you how busy we are. Some of these projects, when we're asked to do it, we will be funded for those. So that's a source of income. I do want to mention the care audit tool right at the bottom, which has been quite successful. I suppose because of the flavour and wave of change there is in the NHS, or at least not so much change, but at least a way of looking at ourselves and wondering how we can do things better. And the care audit tool, CARE, stood for looking at communicate and compassion. I mean, unfortunately, that word compassion seems to have got used and overused. But anyway, we put it in that abbreviation. And working on assisting with assisting patients with their personal hygiene, which is, I suppose, a very broad way of getting down to the fundamental or essentials of care. Relieving pain effectively, that's a big issue that comes into the helpline a lot. And the E stands for encouraging adequate nutrition. Again, that's hit the headlines, hasn't it, in the last 12 months. In our civilized country, how many patients are not getting adequate nutrition. So the care audit tool is something the Patients Association has devised with various trusts and then gone out to other trusts to try and help improve care. One of the major, there were many reports, weren't there, last year, but one of the biggest ones was the Francis report, and some of you may know, but Robert Francis has agreed to be the president of the Patients Association, and that's going to be a huge advantage to us, I think. These are some of the key recommendations that the Patients Association is working to promote. I won't go through them all. I certainly think the complaints system, improving the complaint system so that when things don't work out or that patients' expectations or carers' expectations are not realised, how do they work their way through to make that known? It's all very well, I agree with somebody was saying about the pushy patient, be more demanding with your GP, but yeah, it's not easy for people, particularly as many of the generations grow up to be very respectful of the GP, and the GP knows best, and it's a great thing to actually challenge that. So working with the complaint system is nearly as bad. The complaint system may be there in black and white, but often patients say that a big brick wall comes up when they try to challenge, question, or get clarification on certain things. I suppose the last two are very important. A system based on greater openness, transparency, and honesty. Easy words. And when you meet with practitioners, they often feel that they are doing that and don't understand why that's not perceived. I suppose the biggest drive is a system which sees patients as partners, real partners, and in a minute I've got some case studies, some narratives, just to show you why that's not happening, but you probably know that anyway. Now, when we get a request such as this, and I was talking to someone else who was asking about another area of care, the Patients Association doesn't catalogue or categorise its complaints or the comments it gets from its helpline yet. That may be something we do. So when we were asked to come and share our thoughts with you today, we had to go through some of the comments to find something on a diagnosis. That's something that I think the Patients Association will reflect on, because more and more we're being asked, so what is that? Because we've got such a rich source of data, that the patients are quite happy, by the way, for us to use. That's all established when they give it. They give us their names and all sorts of things, although I've taken those out for today. I really had to ask and go through myself the commentary to see what issues would be pertinent to today's session. And these are the sort of words which I picked out that came from the patients themselves. So, in general, this is what patients, the commentaries, and there are many, many, many commentaries. And they feel that healthcare professionals were perceived, now I put the word perceived rather than are, because I'm not here, as the last three speakers, were to talk about a robust research project. These are just headlines from the sort of narratives and evidence we have. But the word rude is used and used a lot. The word impatient was used. I used exhibiting poor communication skills because you'll see in a minute how that came up. Perhaps none of this will be surprising to all of you, I'm sure. Dismissive and lack of respect, which of course came out in the major reports of last year. What I think is going to be interesting is what do we do with that information? And how do we feed that back to the professionals so that they don't immediately say, but that's not me, that's somebody else. So what I'm going to do now is just share with you some of the stories that have come in. Now, in each of the stories, and I can tell you none of us saw each other, none of us, the previous speakers, there was no communication before. You can see there'll be some similar strands. these are two more. Now, these come in a helpline, and one has to make some assumption that we only get the calls and the messages when patients are at their wits' end and don't know where to go. So presumably the majority of people, and I thought it struck me in the two Lizzes how articulate the respondents were in telling their story. If you could hear some of the phone calls, sometimes the people are not that articulate. They are obviously very emotional, very upset, and just pour it out. The Patients Association tries very hard not to rush in and give immediate advice about what you should do or should not do, or certainly put down the phone and drive round and be with the person, even though some of the calls are very heartbreaking. What we try to do, or what the call system does, is recommend what the next steps should be. And very rarely will the Patients Association go right in there and sit alongside the patient unless it's absolutely necessary or absolutely crucial. So just two more. So, I suppose what these sort of stories tell us is that this is what the patients feel. And that's important. Well, is it important? Who thinks it's important? Certainly the Patients Association feel it's important, and listening to the three sessions we had this morning, they feel, or the two sessions with the three people, they feel it's important. So what we're getting is whether it's right or wrong, whether it happened or it didn't, this is what patients felt. And listening again to this morning's discussion about patients taking more and more ownership and responsibility for their situation and their condition. If this isn't right from the start, why would they do that? Why would they take responsibility and be more assertive? So, what do these stories tell us? And I mean us now, I'm trying to say, this is the sort of interesting bit for me. What do they tell us as the Patients Association? And then how can I, at board level, suggest as an associate dean responsible for an education agenda, how can we use these stories to influence the next generation of practitioners? For me, that's at the heart of it. Well, patients are not always seen as partners in their care. A bit obvious, I suppose. But if you talk to professionals, certainly the newly qualified ones, they say that they are. They don't see it as that. Are we really listening to the patient's count of their health concerns? And I'll put up some ideas and perhaps we'll wind up. We think we are. We've got the, what was the minute, how many minutes slot was it? Was it 7 minutes for a double book if you're clever enough to think that? Hardly any time at all, particularly if you think that the patient has to get in there, get themselves in a state of mind, and many of them now, I recommend they write it down. And certainly when my husband would go, we would write some of the bullet points down when we were calm and quiet at home so that we didn't waste time when we got there. Individuals experience, again I know that I'm talking converted significant high levels of anxiety while waiting for, or indeed hearing their diagnosis. That's if they want to really hear it. I think we had that comment coming up. They need time to digest and ask questions about the diagnosis. So there may be something here about changing the process by which we give the diagnosis. There may be different stages, maybe a stage 1, a stage 2, a stage 3. Of course that's going to cost. And then, this is my own bit really, is this issue addressed sufficiently in the preparation programs for healthcare professionals? And I should add, health and social care professionals. I should add that. In other words, how well are we taking some of this critique, actually, back into so that professionals can hear it themselves? So I keep using these phrases potential because I haven't done a robust study. But potential causes of poor patient experience. Well, there seems to be a lack of openness and transparency. Patients unable to make choices, here we have that word choice, if indeed they understand what that means, unless they have clear, accurate and timely information. And that raises the issue about whether how well prepared are professionals when helping patients to make a choice, giving them all the facts? Do they feel that it could be too much? Are they making their own judgments about how much information to give? I would say they probably are. The complaint system does seem to be failing patients. This hinders the ability of the NHS to listen and learn, probably linked to the pace of work. On to the next thing, on to the next one. How many have you got through today? And unless it really listens and works out the wheat from the chaff, really, they're not really going to be able to improve things. Pressure to reduce waiting lists and initiate treatment. I mean, that is very evident. Targets, objectives. Do they divert our attention away? Do they divert our attention, I should be saying now, away from the process that we should be doing, rather than just ticking that we've seen so many patients and they've been through our clinics or our surgeries? And then possibly, as a campaign that we're just about to start, there does seem to be a lack of appreciation of the emotional impact of the diagnosis. And that may be that healthcare professionals themselves haven't had enough time to really digest and reflect on that. But if they could hear from the patients, probably not at the time, but through narratives and stories such as you've got, such as we have, maybe that would help. So, what are our recommendations? Well, involving patients in their care will only happen if healthcare professionals have the time and motivation to see them as equal partners. I mean, that seems so trite just to put that up like that. But it really is an important part. And those of you involved with education will know that in the medical, I'm not so sure of the social work curriculum, I'm not so familiar with that, but with nursing, midwives, physios, OTs, all the other health professionals, the curriculum is jammed with people saying they must be able to do this by the time they qualify. Maybe we have to find space for this sort of reflection, digestion and dialogue. There's no doubt sufficient resources do not seem to be available, whether they're human or financial, because they're both linked, because I suppose the finance pays for the human. Sometimes I think, as a healthcare professional, we make ourselves busy for whatever reason. Use patient experiences to encourage reflection by healthcare practitioners. That may be something we need to think in the way we deliver our curricula, rather than, seminars, tutorials. The shift, I'm glad to say, is moving away from big lectures. They will always be the big lecture, there's no doubt about that. But they should be inspirational, they should be setting the students thinking. Probably the real internalization of some of the facts will come through seminars and tutorials, which is going to take more time. And a big one, we use the word transform rather than inform, advise. There has to be a transformation of professional healthcare practitioners' attitude to the diagnosis, which is why my question was coming about how does the research, not just from the bits we heard this morning, but presumably many of you doing research, how does that research have its impact? And I realised, just as the ref door closes, that is a pretty obvious statement. But how is the research impacting on at least practice? Certainly the Patients Association is working hard to see if there could be an impact on policy. But there does seem to be room for more thought, more deliberation, more reflection on the psychological implications, and I would say the unintended consequences of diagnosis. And this is in addition to clinical competence, not instead of. Because many of the complaints are saying, I don't think they know what they're doing. We know it's complex. Some diagnoses are very difficult. So we're not saying that the clinical competence should be any less, but certainly there should be more time spent on the whole aspect of diagnosis. So, in essence, those 4 statements are the Patients Association's premise for working for the next year on this particular topic, amongst many other things as well. These are the main issues. And I'm happy to take any questions. That's my presentation. Thank you.